ಸೆಟಲ್ ಆಗಿದ್ರಾ? ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣ. ಸೊ ಕ್ಷಿಪ್ರ ಮರ್ಮ ಕ್ಲಿಯರ್. ಸೊ ಕ್ಷಿಪ್ರ ವಿದ್ಧ ಮಾಡಿ ಅಂದ್ರೆ ಎಲ್ಲಿ ಮಾಡ್ತೀರಾ? ಕ್ಷಿಪ್ರ ಮರ್ಮ ಮೇಲೆನಾ 2 अंगुल above ಕ್ಷಿಪ್ರ. So usually sir used to tell us, ये इसका क्षिप्र ले ले. So that's why I asked. Next, very common case. Gridrasi Vishwachi. So what it is, the shloka goes, Chano Sandher Uparya Dhova Chaturangule Gridrasyam. Gridrasyam iva Vishwacha. So same as that of Gridrasi, in Vishwachi we have to do. But there is a catch point over here. See the second shloka, last line shloka. What they have told? Gridrasi Vishwachayoho Sankuchita Janukulparasya. So this shloka is told in previous chapter. It's not told in same chapter. So this position should be there while doing Viddha karma, or else you won't get results. Straight leg, you do Viddha, no results. You should flex the leg of the patient and then do Viddha. Even while Vishwachi, flexion of hand and slight external rotation, and then you do Viddha on lateral aspect. So that is important. That position is important. Yes? Scale it. Any volunteer? ಬನ್ನಿ ಬನ್ನಿ ಬನ್ನಿ, ಯಾರದು? ಒಂದು ಚೇರ್. So 4 अंगुल is above, below. Either above, either below, or both. 4 अंगुल is how to measure. Ask patient to show his or her fingers. Yes? Now, scale. Exact middle point. Yes? So, approximately 6 centimeters is her foreangular. Yes? Now, for Gridrasi, Sankuchita Janu, straight. So, coronary plane, you know, in anatomy, coronary plane. Yes. So that plane only, on that, if we have that line, so it will go exactly from sides, like this. So on that plane, 4 angula. In this case, it is 6 centimeters. From the knee joint, there is one bony protrudence over here. Yes? What is that called? Don't know. Whatever it is. Okay? So from there, 6 centimeters. Below, from there, 6 centimeters above. I'll show this side also. This bony point, from here, 6 centimeters below, 6 centimeters above.
You can see here.
Yes. Similar thing in hand. So hand also sankuchita, but little bit extension, external rotation, little bit partial. So 6 centimeters above, somewhere here, 6 centimeters below. If you do with like this, the points will vary. Proper Viddha will not happen. Points will vary. Position matters. Yes? Should I mark it or you understood? Understood? Mark? Okay. Six centimeters from this bony point. This one from here, this one. So these 2 points are for Vishwachi. Similarly, Gridrasi. It depends what type of Gridrasi it is. I'll come to that. Right. Yes. So, if the pain is from lateral aspect, laterally, pain is from front, still laterally. Sometimes pain goes medially. That time you can do it on medial side. Yes? Same. 4 angulars above, 4 angulars below. Yes?
In hand.
Medial side also same. Hand, only this is the way. In medial side it is for Shwasa Kasa Pliha Yakrut Udara. In hand medial side here, if we do, it is for Shwasa Kasa. There, no need of maintaining the position. You can do it on straight hand itself. Yes? Thank you.
So what if the radiation is around the posterior aspect?
Posterior aspect also side. Yes, lateral only. Understood, right? 4 angulars above and below, Kurpara and Janusandhi. So these are the type of pain in sciatica. Full complete, anterior complete, medially it goes, and very medially it goes. Sorry, this is anterior. Here below it is coming from anterior. So this is L5, L4, L3 and S1. So these are nerve roots. So based on this pain, we should also do Agni Karma on that particular root. How the pain is. Based on that particular root of that particular patient, we have to do Agni Karma with Swarna Shalaka. That time, still more better results we can get. Yes, next. Apabhavaka or avabhavaka. So what it is told? Vadante amsayor antare. Yes. So when you see the rotational movement and all the movements of shoulder joint, sometimes what happens is patient is able to lift the hand, but because of this swelling in this trapezius muscle, what happens is patient is not able to lift the hand. So that time, this is trapezius muscle, this is upper border which goes on the shoulder like this. So on that point, we take 3 points. I'll demonstrate that also. So here, 1, 2, 3. that point. If trapezius is the culprit. If it is inflamed, or if it is, there is a stiffness in that particular muscle. If patient is not able to lift also, little bit also is not able to lift, something is wrong in the ball and socket joint only. That time what we have to do is prick over here in this, what you say, depression you can feel over here. When you extend the hand, you can feel the depression over here. Exactly in that depression, when we prick, it goes exactly in this area, and if at all the inflammation is there, there is a release of that particular inflammation, because from there the Raktasrava occurs. It might be seen visible or it might be inside also. Raktasrava occurs and immediate relief is seen. If the inflammation is in anterior side, patient is not able to do this movement. So prick from deltoid, acromion process is there, right? In front of that 2 angulas, if we prick, this will take care of this pain. So this is Viddha. But in 60 to 70% of cases, Viddha doesn't work in Avabhavaka. There what works is Agni Karma. Agni Karma, that too with Good. So here again one more story I would like to share of Vaidyara R.B. Gupte sir is, he had gone to take lecture in some college. Suddenly one patient came in hospital with Avabhavaka. In hospital, where to search Guda? Yes. So sir asked, anyone in this crowd is having eclairs chocolate? So luckily one fellow was having that. He took that, did Agni Karma with that, gone. So yatha saukhyam yatha labham. So you should not stick only to that. Similar to that also you should know what are the other options. Similar to that. Yes, obviously that won't give the same result as that of Guda, but it gives to certain extent in emergency. Yes. So this is Apabhavaka. Anyone? I need male thing because I need to show it on trapezius muscle. Yes. Shirt ತೆಗಿಬೋದಾ? Thank you. ಅಲ್ಲಿ ಕ್ಯಾಮೆರಾ ಇಲ್ಲಿ ತಗೊಂಡು ಬರ್ಬೋದಾ? ಇಲ್ಲಿ ತಗೊಂಡು ಅಲ್ಲಿ ಕಾಣುತ್ತಲ್ಲ, ಅದು ಓಪನ್ ಮಾಡಿ. ಎಂಡ್ ಮಾಡಬೇಕಾ? ಹೀಗೆ ತೋರಿಸು. ಸರಿ ಹೀಗೆ ತೋರಿಸು. So everyone is it visible for everyone? So I will just draw a rough sketch of trapezius muscle. From here it goes down. Okay, what we need is this two upper borders. How we can find upper border is we should palpate C7 vertebrae. This is the prominent vertebrae, C7 vertebrae, anyone knows? So from there, straight. From there, whatever the line goes on the shoulder, on that line, we should take 3 points. You can see over there. Two angulars of patient. In this case, it is 4 centimeters. 4 centimeters, okay? So from C7, 4 centimeters. One. From that point again, 4 centimeter. 2. And from that point, 4 centimeter. 3. So on these 3 points, we will do Viddha karma. Similarly on other side, from C7, 1. From that point 4 centimeters. In this case I am telling, not 4 centimeter always. In this case, and 3. Yes. So on these 3 points, if we do Viddha karma, he will get immediate relief when there is a stiffness of trapezius muscle. But when there is a problem in ball and socket joint of that particular patient, if it is stiff above, so ask patient to extend the arms. You will feel this notch over here. So on this particular notch, you have to do Viddha. And again, 4 centimeter from this, if it is posteriorly, some patient will tell posterior I am not able to do. So 4 centimeter here, 4 centimeter here, if it is anterior. So it matters where and how the pain is. Yes, based on that we will do. And Agni karma also on this point. As this pain is of Snayu Gata, this pain is. So Guda is important. Yes. So Agni karma on this point only. Especially this one Agni karma on this point. If at all it is not coming down, then these two also can be taken. But most of the time, in 50 to 60% cases, this one Agni karma is sufficient. Yes, that's all. Thank you. From the pit, that point. Clear? Huh? Okay, so on the trapezius muscle, from the C7 vertebrae, 2 angulars on the above border, superior border of trapezius muscle. Next, on acromion process, near that there is one pit or depression. In that depression, 2 angulars above that, 2 angulars below that, behind that. Not above, in front and back. Huh? Yes, depth again on the trapezius muscle, half vrihi. But in this notch, on 2 vrihi goes inside. If exactly you have located, without any struggle, without any obstruction, 2 vrihi goes inside that particular notch. Yes, and rest these 2 half vrihi only. Yes. Udarashula. Again, next common condition which is there in our clinics, Udarashula. Just now I had got a call. Last time, a patient, she was telling that after menses, she used to get Udarashula. After menses, everything gets over, she used to get Udarashula. So for that, they had called, sir, last time you chuchidrala, adu chuchlikke idira anta. They had just called me. So this time also it has, yes, pathology might be different, but she had Udarashula and we had done this Udarashula point for her. So where exactly is the point is, see, this is anterior superior iliac spine. Everyone can palpate their own. Yes. From there, if we draw a line till Nabhi, imaginary line from anterior superior iliac spine to Nabhi, from here also same. Then 2 angulas above that from anterior superior iliac spine. 2 angulas of patient. That is very important. So those 2 points what we get is the points for Udarashula. Pravahikayam Udarashuliyam, that is they have told. Yes? So, one second. Okay. So, first thing and foremost thing is anterior superior iliac spine you have to locate. From there, imaginary line to Navi. Similarly on other side. So from anterior superior iliac spine, 2 angulas on that line towards Navi. And prick should be Ardhavri Pramani. Perpendicular to the skin surface. Yes? Exactly what I wanted this question. What if the person is obese? What can we do? Any suggestions? Huh? Yes, one thing, depth can be increased. Yes. One vrihi we can go. Next. Will there be a change? Huh? Huh?
Making the person to sleep.
Yes, that can be done because we will get a flat tummy if we make the person sleep on lateral side.
We can do something.
No, that is constant. If that patient is having swelling in his hands also, you should take that Anguli Pramana only. But when the patient is having one hand swollen, other hand normal, normal hand should be taken, not swollen hand. But both the hands, both the feet are swollen, that swollen thing only should be taken because Purusham Viksha. That swelling is in whole body. So based on that only we have to take. Yes. Next, Antravruddhi or Udarashula or Ashmari Shula. They have told Tvacham Bhitva Angushta Madhye Dehe Cha Anga Viparyayat. Dehe Cha Anga Viparyayat. So, Antravruddhi, there is a hernia or Ashmari Shula, severe pain, callicular pain. So, this is the point. Popularly, it is been said as Angushta Mula point, but it is Angushta Madhye. Exactly where, if we draw a line, horizontal line, metatarsal joint, horizontal line, and vertical line from the lateral aspect of your big toe, nail, toenail in the lateral aspect in the, if we draw a vertical line. So we get a segment from a base of a toe and this line. So in between exactly is the point. I will demonstrate this. This shall I demonstrate or you understood? Understood. So this I will demonstrate on 2 or 3 of the subjects. Please sit in 3 different places so that everyone can see. Any 3 subjects. So I'll just show the point. I'll mark and I'll just show the point. Because this is important. People prick on the other side. This is a huge mistake which is seen in this particular Viddha. People prick on the other side. That's why simple way to remember this point is in our Indian tradition, married woman wears touring. Exactly where it touches, that is the point. Simple way to remember. Exactly where it touches, that is the point. And that is the significance. Like after marriage, she has to sometimes control the urge, urine urge. Sometimes many Vegas she has to control. For that, this will constantly touching that particular point and triggering that, and she will be healthy. That is the reason behind this. And only Rajata Dhatu can do this, not Swarna. Yes? So exactly where it touches, that is the point. So I'll demonstrate on these 2. Pen ಕೊಡು. ಹ್ಮ್? ಸ್ವಲ್ಪ ಹಿಂಗೆ. ಹಾಂ. ಇಲ್ಲಿ ಫೋಕಸ್ ಮಾಡಿ. ಇಲ್ಲಿ ಫೋಕಸ್ ಮಾಡಿ. ಹ್ಞೂ. So this is the joint, right? So from here, if we draw horizontal line and vertical line from the edge of the nail, lateral aspect, not medial aspect. This is lateral, that is medial. So we get a segment, this 2 segment, this 1 segment, these 2 points. So in between that point, this is what we call Angushta Mula or Angushta Madhya. What point is exactly this one? Yes? So lateral aspect, not medial aspect. That's why where the toe ring connects, where it touches, that is the only point. See, ille. Ille.
Sir, while finding this point, what is the significance of this line? Sir?
This line. Yeah, to find exact this line, to get this segment.
So how to find that line?
Line, see, this is the joint.
Yes.
On this joint only I have drawn the line. So you will get that line.
Before that was treated this point.
No, no, no.
The midpoint.
We want midpoint of this too. If we continue this line, it can go somewhere beyond also. So we want midpoint of this too. ತೋರ್ಸಿ ಆಯ್ತಾ? ತೋರ್ಸಿ ಆಯ್ತಾ? ಆಯ್ತಾ? ಮಾಡು 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 ಮಾಡು. Exact the joint. On the lateral aspect.
On the lateral aspect, medial aspect, ಇದನ್ನ ನೋಡ್ಬೇಕು. ಓಕೆನಾ? ಅದಾದ್ಮೇಲೆ so we need to take one more the horizontal line exact ಆಗಿ
Middle point.
ಲೆಂತ್ ಎಷ್ಟು ಇರುತ್ತಲ್ಲ, ಸೊ 2 ಸೆಂಟಿಮೀಟರ್, ಸೊ ಹಾಫ್ ಮಿಡಲ್ನಲ್ಲಿ ಇಲ್ಲಿ ಅರ್ಧ ರೋಗಿ ಅಂದರೆ ಅರ್ಧ ರೋಗಿ ಮಾಡಬೇಕು. ಸೊ ಓನಿ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದೆ ಅಂತ ಹೋಗಲ್ಲ ಅಂತಲ್ಲ.
So on that exact point, you can exactly pierce Ardha Vrihi Pramana. If there is a bony prominence there, that point is wrong. So you have to reconsider your calculation and see again. Yes, whose pen is this? Pen. Pen. First and foremost thing, joint. So horizontal line on the joint. ಆಮೇಲೆ this is medial side, lateral side. So this segment we get intersection from here till here. So exactly midpoint. Exactly midpoint of this. Antravrutti. Hernia and Ashmari Shula. Ardhavrihi. On this point also it is Ardhavrihi Pramana only. Yes. Not more than that. Remember, it is on lateral side. Condition is Andhra Vruddhi. Mainly this shloka is told for Andhra Vruddhi. Andhra Vruddhi Chikitsadalli, if you go, you can find this shloka. But this can be done in. Yes. Next day, patient come with Ashmari. Largest Ashmari sir had got was 14 mm. Very next day, patient had got. Yes. Yes. Largest Ashmari was 14 mm. Plihodara, Yakrutodara, Shwasakasa. For Plihodara on left side, Yakrutodara on right side, Shwasakasa both the side. Yes. Before that, that Antra Vruddhi and this point was there, no? I had my personal experience. I had gone to Sir's visiting in Nanded. When he goes to Nanded, he takes 2 of the students from Pune to Nanded. So I had gone once. So one patient had come, severe abdominal pain, and he was not able to climb the stairs. Sir's clinic, he sees in his own flat, so it is on first floor. He was not able to walk, and luckily that day sir was not well, so he was giving to students to do with the karma. We are lucky. So I told sir, it is an emergency, he is not able to walk, so much unbearable pain it is. Sir told, take Kshipra, Angushtamula and come. I did that. I went inside. I forgot that I did with the karma to that, and I came inside. After 5 minutes, the patient is walking and coming to sir. This was my first experience of Angushtamula. My first experience. I was also shocked. How come patient was not able to lift his leg like this? 2 people had accompanied him. He came walking. That fast it works. Yes, next we'll go to this. So next, Plihodara, Yakrutodara, Shwasakasa. So in Plihodara, in left arm, Yakrutodara in right arm, Shwasakasa, both the arms. What is this? Medial aspect. 4 angul is above, 4 angul is below. Medial aspect. In Vishwachi we saw it all lateral aspect. And there one more important thing was position. Here there is no nothing like that. Yes. So on medial aspect we have to do. And one more thing. Kanishtika Anamikayor Madhye. Kanishtika Anamikayor Madhye. Yes. Exactly in between Kanishtika and Anamika. Seems to be painful, but trust me, once you prick it over here, patient will get release. Immediately in Shwasa Kasa, it is proven. I have seen. I have done. If patient comes with that heavy breathing, do this. Immediately he will get 50% relief then and there. Later you can give medicines later and all you can manage whatever however you treat. But immediately once if you do this, he will feel easy. Yes? Yes. Half free. So wherever I don't mention the pramana how much to insert, half free. Yes? Yes, exactly in between. No. So this flank ತರ ಇದೆ ಅಲ್ಲ ಅಲ್ಲೇ perpendicular 90 degree to that particular yes perpendicular prick it like this perpendicular not like this in between this midpoint yes midpoint understood demonstration needed yes or no yes what you only patient अभी है heaviness come हिंदी इंग्लिश हिंदी क्या फील हो रहा है माइक
So if I start coughing, it will be a continuous cough and reduce and
heaviness pain here so heaviness in chest okay so everyone saw what is the condition heaviness in chest if she starts coughing she will continuously cough ये ऊपर जाएगा the box will skip 4 angulars measure it first For her it is 7 centimeters. Yes, from midpoint 7 centimeters. Can you give me one pen? Yes. Above, below. Yes. Hmm? So exactly on this point, force anguli above half rihi, half rihi, and this half rihi. Half rihi, half rihi, half rihi. Sorry. ಪ್ರೆಸ್ ಮಾಡಬೇಡ ಬರಲಿ.
ಸರ್ ನೀವು ಬ್ರೇಕ್ ಮಾಡುವಾಗ ಫಸ್ಟ್ ಹಾಕಿ ಆಮೇಲೆ
ಇಲ್ಲ ಇಲ್ಲ ಇಲ್ಲ, ಅದು ಹಾಫೇ.
ಹಾಕುವಾಗ ಫುಲ್
ಹಾಕಿ ಹಾಫೇ ಹಾಕಿ. कैसा लग रहा है? Heaviness. See, heaviness has reduced in chest. Pain? Pain also reduced. हॉस्टल में करना.
Thank you very much.
Prick ಮಾಡಿ ಮೈಕ್. So we'll ask her after some half an hour, 1 hour, how she feels. We'll see till how much relief she can get, till what time. Okay? Everyone hungry, I guess. No? Hungry for knowledge, I'm asking. So, okay, we saw this. Lihodara, Yakrutodara, Swasakasa. Any Yakrutodara means cirrhosis also comes here. Any kind of Yakrut Vikaras, where there is swelling involved for Yakrut. Pliha similarly. Yes. Next. Yes. Simple, but very painful. Nasa roga, and in Gandha agrahana. What it is Nasa agre half rihi. Nasa agre half rihi. So anosmia, COVID, pricket. ಪ್ರತಿಶಾಯಕ್ಕೆ ಸರ್ ಇದು ಕೊಡೋದು ಉಪನಾಸಿಕ ಕೊಡೋದು. Upanasika. One more thing is just where there is a crease, where it starts. This is Upanasika. So in Pratishaya, this should also be taken along with this. This crease, while laughing, you will get one crease, no? In, I guess, old people will see it more prominent. Or in full chubby people, you'll see more prominent. So, there exactly where the crease starts, there. That is Upanasika. So along with Nasagre, if you do Upanasika, you will get relief. Like patient will get relief in Pratishaya also. Yes. Yes. These 3 points only. Polyp, you can do Bhallataka Taila application. Polyp. That is one wonderful Taila. Hearing to Bhallataka, what we feel is gone. Burning. Yes. So I'll like to share one more story of my sirs, Chandrakumar Deshmukh sir. So while he was doing second year BAMS, I told him he used to go in all Panchakarma therapy room and all everything, Basti and all used to do. So once sir told, give Matra Basti to his sir, some sir in college, he told, give Matra Basti to that patient. ತೈಲ ಯಾವುದು ಅಂತ ಹೇಳಲಿಲ್ಲ. So whatever available taila was there, he pushed, and it was Bhallataka. Bhallataka taila. Okay. So after everything happened, sir asked, which taila did you put? Sir, कौन सा तो तैल था वहाँ पे डाल दिया मैंने. कौन सा वो बॉटल में रखा था वो क्या? हाँ सर, क्या हुआ? अरे वो Bhallataka taila था. He got scared. Patient won't come, I guess he will be some coma, he got scared like that. But next day patient came, he told, I am feeling better. Why? Why? Because on mucus layer, Bhallataka acts best. It doesn't irritate when it is in contact with mucus layer. Only when it is contact with skin layer, it burns. That's why Bhallataka Taila Pana is also indicated, but after lap of ghee. Because after going inside, it is mucus layer only. So in contact with mucus layer, nothing happens. Okay? So Nasa Roga, Gandha Agrahana, Nasagre, Vedana should be done. And in polyp and all, Bhallataka Taila. Simple, if you don't have Taila, take Bija, press it in between the forceps, artery forceps, and just heat it from below. It will start oozing out the taila. Take it in earbud, put it, apply it, done. Within 2 to 3 sittings, polyp is gone. Sometimes within 1 sitting, polyp is gone. No, keep it like that. Polyp is gone.
In allergic rhinitis,
Same. All the Nasa Roga. There, that's why Nasa Roga, everything whatever related to Nasa comes in there. Everything. Huh? Nasa agre. ಮಾಡ್ತೀರಾ ಯಾರಿಗಿದೆ ಬನ್ನಿ ಹಾಂ One more thing, while putting, inserting the needle, we have to press, squeeze this, and then insert it. Okay? ಎಲ್ಲಿ ಹೋದ ನಾನು ಎಂಡ್ ಮಾಡೋದು ಸ್ವಲ್ಪ ಕಣ್ಣಲ್ಲಿ ನೀರು ಬರುತ್ತೆ ಸರ್ pinch it, half free here, remove it, Panasika, रिलीज आयचं सर कमी आहे airway open ಆಯ್ತಾ see airway opened immediately
Nasal block reduced. Yeah.
And one more thing, if the rakta is coming, you should not press it, just wipe it. ಇದು ನೋಡಿ ಇದು ಕ್ರೀಸ್ ಇದೆಲ್ಲ ಇದು ಸ್ಟಾರ್ಟಿಂಗ್ ಪಾಯಿಂಟ್
ఎక్కువ ಮಾಡಬೇಕು along with
ಮಾಡಿ ಒಳ್ಳೆಯದು So immediately the relief sir experience, not me. Oh shit. So exactly that is the prick on Nasagra. Yes. Next, Kati Shula. Sitting. We get back pain. Yes. So the thing is, where exactly the back pain is. Lower back pain. I am specifically talking about lower back pain. So first, you have to locate the L5. Then based on where the location of the pain is, based on that we have to mark the vertebrae. And in between that gap, that is approximation, I am not telling exact, on paraspinal muscles, not on the vertebral column. On paraspinal muscles, when we prick Ardhavrihi Praman, pain will go. So how many what length he is having pain? So on that complete length, in between the vertebral gap, on paraspinal muscles. Usually the gap between 2 points is 2 angula again. 2 angulas of that patient, not yours. Yes. So these two are vertebrae. So in between the gap is there, right? So that on on the paraspinal muscles. Yes, I'll demonstrate that also. I need one boy, male candidate. Anyone. Patient, patient idre ಒಳ್ಳೆದು. We can see the results. Stool ಇದೆಯಾ? ಸ್ಟೂಲ್ ಸರ್ ಕೂತ್ಕೊಳ್ಳೋಕ್ಕೆ ಅಥವಾ ಇಲ್ಲಾಂದ್ರೆ ಹೀಗೆ ಕೂತ್ಕೊಳ್ಳಿ. ಇರ್ಲಿ ಸರ್ ಹೀಗೆ ಕೂತ್ಕೊಳ್ಳಿ. ಯಾವುದು? ಅದು ತಗೋ. ಇಲ್ಲಿ ಮಧ್ಯದಲ್ಲಿ ಹಾಕುತ್ತಾರೆ. ಹಾಂ, ಹೇಗೆ ನಿಮಗೆ ಹೇಗೆ ಕಂಫರ್ಟೇಬಲ್ ಆಗುತ್ತೆ ಹಾಗೆ. So I'll just draw a schematic diagram on his back and we'll see the points. Shirt every time ask patient to only lift his clothes. Yes, once he lift, you can adjust it based on your convenience. Ethics should be first. Now, locate anterior superior iliac spine. So this is the bony prominence. So line if we draw like this. So this is L5 vertebrae. The line goes like this. Yes? Pain ಎಲ್ಲಿದೆ? ಇಲ್ಲಿ ಇಷ್ಟೇನಾ? ಹಾಂ, ಕೆಳಗೆನಾ? ಇಲ್ಲಿ. ಹಾಂ. So he has near the coccyx bone. Yes? So we will take approximately I'm taking. So this is sacrum, S1 in the, if we take this sacrum. Did you fall and get the pain? Where did you fall? Huh? Steps. So fall is there. So should we go here directly? Shipra madam. Yes. So I'll go that side again. Then I'll come here. So first Kshipra, Ardhavrihi, Ardhavrihi, and then I'll come there. Now again non paraspinal muscles means 2 angula here of his scale. Scale. ಇಲ್ಲ ಆದಿತ್ಯ ಕೈಯಲ್ಲಿ ನೋಡಿದೆ ನಾನು. So 2 angulis. It's almost 3 and 4 centimeters. So 4 centimeters from this vertebrae. So almost this line it comes. This line. So on this line only, on paraspinal muscles, this is a paraspinal muscle line. So it will be almost 2 angulas of patient. So in this gap, Ardhavrihi he is having till end. So we will go till down. And prick will be always 2 angulas only. Right. Done. How is the pain? You tell me. Really, the cap. ಅಲ್ಲಿದೆ ಅಲ್ಲಿದೆ ಅಲ್ಲಿದೆ. You can walk and see how the pain is. Released? ಕಮ್ಮಿ ಆಯ್ತು. So really it reduced, right? Yes. Cotton. Cotton good. So first important point was he had a fall over there. So that's why first we had taken Chipra. Directly if you would have taken back points, no results. So how Samprapti goes, based on that we have to decide. Similarly in all the Vyadhis, how the Vyadhi Samprapti goes, based on that we should decide. Like people come to me, what are the infertility points? No. I had one patient who was tortured, who was mentally sick, I will tell. Like she was like, why we are getting periods? I don't want this female Janma. That level, and their own family members had only made her think like that. No one else. So there Manasika Viddha played a role. Not any infertility related Viddha. So how the Samprapti goes, similarly the point should be chosen, not exactly that point. Yes, the main formula is that big shloka, but again what is the Samprapti of that Vyadhi you should see, and that then apply that formula. Yes.
If the pain is in above region, then you have to take the points above.
Yes, yes. Above L5, the pain is above L5 region, we should take points, similar points above. Yes. Jano Sandhi, that's what. Knee joint pain. So this actually lower back pain and knee joint pain is not explained in our classics. That has been taken from acupuncture science. So here I want everyone to palpate their knee joint. First patella. So where the patella has point downwards, besides that there are two notches. So exactly those two notches are these points. Here patella has been dissected and taken above, but these are exactly these 2 points, 1 and 2. And these 2 points are on the bony prominence, which we had seen while taking points of Gridhrasi. So these 4 points are for Janu Sandhigata Vata. Two notch and prominence, bony prominence.
Over that.
Side ಅಲ್ಲಿ ಸೈಡ್ ಗೃದ್ರಸಿಗೆ ತಗೊಂಡೇವಲ್ಲ ಇಲ್ಲಿ ಮತ್ತೆ ಮೀಡಿಯಲಿ ಲ್ಯಾಟ್ರಲಿ. ಅಂಡರ್ಸ್ಟುಡ್? ಎನಿ ಡೌಟ್ಸ್ ಹಿಯರ್? ಸೊ on those bony, see medially and lateral there is bony predominance. Medial collateral ligament, there is one where the medial collateral ligament ends on this bony prominence, that point. And medially, laterally and medially, there is a bony prominence. And two in middle, where the patella is ending. Besides that, just there are 2 notches, one on left side, one on right side. So in that notch, again Ardhavrihi Pramana.
On those 2 bony prominence,
Huh.
below that.
On that one.
On that
Yes,
from
yes,
that
yes, yes, yes. Ardhavrihi. Yes. Understood? Yes. Anyone? Come, 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 come. Fast, quick. Patient, anyone is there? Who?
here.
Oh, you are only the patient. Fine. ಮೇಲೆ ಹೋಗುತ್ತಾ ಅದು ಹೇಗೆ ಶುರು ಆಯ್ತು ಅದು
long-term practice.
ಏನು ಪ್ರಾಕ್ಟೀಸ್
Yoga.
ಹಾಂ
Yoga.
ಹಾಂ ಹಾಂ ಹಾಂ
It's on both knees.
marker. I'll just show what points. So this is patellar downward. This is patellar, right? Hmm? So there are two notches over here. Exactly this one, this one. Laterally, one here. This one bony prominence, one here. So these 4 points. 2 more points are there in this, where we take it while there is a degenerative changes. Old patients. Exactly in midpoint of these two. So totally 6 points, but most of the time these 4 are only in practice. This on degenerative cases. Similarly here.
So irrespective of whether the knee is having ama at the time, sama at the time, we don't have to consider.
Ama, that we have to consider.
That was
Ama, if it is there and if we do, it will aggravate. It will aggravate severely. Nirama, only we have to do Siraveda. Ama, Agni karma on same points. What is yours?
not fit.
Huh?
Not fit.
Not fit to do Sama. Okay. So Agni karma we can try. We can try? ಅಲ್ಲಿ ಒಂದು ಪೌಚ್ ಇದೆ ನೋಡಿ ಅದು ಅಲ್ಲ ಪೌಚ್ ಪೌಚ್ ಹಾಂ ಹಾಂ ಮಾಡುವ ಹಾಂ ಇದು ಡೆಮಾನ್ಸ್ಟ್ರೇಟ್ ಮಾಡಿ ದಿಸ್ ಇಸ್ ಮೈ ಕಿಟ್ ಓಕೆ ಫ್ಯಾನ್ ಫ್ಯಾನ್ ಆಫ್ ಮಾಡಿ ಹಾಂ ಸ್ವರ್ಣಚಲ So we don't directly heat it, we just keep one end, this broader end, on the patient's surface, skin contact, and on other end we heat it. And we ask patient to take the heat as far as she can tolerate. Yes, and it should also be perpendicular to the skin. Not like this, not like this, exactly perpendicular. How did you conclude it as Ama?
Because my history is it started because I used to drink water before I did my practices. So it's a long-standing presence, and I've done Nirama Chikitsa. Okay, now I would stop.
So how much ever patient can tolerate. Swarnashala.
Based on history, and you require to do many sittings.
No.
ಸರ್ ವಿದ್ಯಾಕರ್ಮ ಬೇರೆ ಪಾಯಿಂಟ್ಸ್
ಯಾವುದು ಬೇರೆ?
ಅಲ್ಲ ಅಗ್ನಿ ಕರ್ಮಕ್ಕೆ ಪಾಯಿಂಟ್ಸ್ ಇಲ್ಲ ಅಂತ.
ಅದೇ ಇಲ್ಲ, ಬಟ್ ಇದಕ್ಕೆ ಮಾಡ್ಬೋದು. ವಿದ್ಯಾಕರ್ಮ ಪಾಯಿಂಟ್ಸ್ ಕ್ಯಾನ್ ಆಲ್ಸೋ ಬಿ ಟೇಕನ್ as Agni Karma points. But not all Agni Karma points are taken as Viddhakarma. Viddha points are specific. ಈಗ 22 ರೀಚ್ ಆಗಿದೆ, 22,000.
ಆಗುತ್ತೆ ಸರ್.
ಒನ್ ಟೈಮ್ ಇನ್ವೆಸ್ಟ್ಮೆಂಟ್. ಲಾಸ್ಟ್ ಇಯರ್ ನಾನು ತಗೊಂಡುವಾಗ 16.5 ಅಲ್ಲಿ ತಗೊಂಡು. ಇಲ್ಲ ಆಗಲ್ಲ. ಇದೆ. It is actually 16 to 18 karat gold, 7 centimeter in length, 2 mm in diameter, a whole shaft, and the head is 4 mm diameter. ಹೌದು, ಇದೇ ಸೈಜ್ ಇರಬೇಕು.
Sir, and from doing ulta, will there be a problem?
ಉಲ್ಟಾ ಅಂದ್ರೆ
In the sense, ಇಲ್ಲ ಯಾವ ಕಂಡೀಷನ್ ಅಲ್ಲಿ ನೀವು ಅಗ್ನಿ ಕರ್ಮ ಮಾಡಿದ್ದೀರಿ ಅಂದ್ರೆ
ಏನಲ್ಲ,
ಸ್ವೆಲ್ಲಿಂಗ್ ಇದ್ದಾಗ ಮಾಡ್ಬೋದಾ?
ಮಾಡ್ಬೋದು.
ಎರಡು ವಿದ್ದ ಮತ್ತು ಅಗ್ನಿ ಎರಡು.
ಅದೇ ಆಮ ಇದ್ರೆ ವಿದ್ದ ವರ್ಕ್ ಆಗೋದಿಲ್ಲ.
ಡೈರೆಕ್ಟ್ ಆಗಿ ಮಾಡ್ಬೋದಾ?
ಹಾ, ಒಂದು ಆಮ ಅಂದ್ರೆ ಯು ಕ್ಯಾನ್ ಟಚ್ ದ ಫೀಟ್ ಅಂಡ್ ಸಿ, ಸ್ವಲ್ಪ ಹೀಟ್ ಇರುತ್ತೆ, ಅದು ಆಮ. ಇಲ್ಲಾಂದ್ರೆ ಕೆಲವೊಮ್ಮೆ ಏನಾಗುತ್ತೆ, ವಿ ಅಲ್ಲಿ ಮಿಸ್ಗೈಡ್ ಅಂಡ್ ವಿ ಡೂ ವಿತ್ ನೆಕ್ಸ್ಟ್ ಡೇ ಪೇಷಂಟ್ ಅಲ್ಲಿ ಟಚ್ ಇಟ್ ಸಿವಿಯರ್, ಅವಾಗ ಟ್ರಿಗರ್ ಆಗಬೇಕು. ಇಲ್ಲಾಂದ್ರೆ ನೀವು ಅವಾಗ ಕೂಡ ವಿದ್ದ ಮಾಡಿದ್ರೆ ನಾವು ಯೂಸ್ ಆಗೋದಿಲ್ಲ.
ಸರ್ ಒಂದಕ್ಕೆ ಮಾಡಿ ಇನ್ನೊಂದಕ್ಕೆ ಮಾಡ್ತಾ ಆಲ್ರೆಡಿ ಹೀಟ್ ಇರುತ್ತೆ, ಗ್ರಾಜುಯಲಿ ಆಗೋದ್ರಿಂದ ಏನಾದ್ರು ಸ್ಪೆಸಿಫಿಕ್ ಸಿಗ್ನಿಫಿಕೆನ್ಸ್ ಇದೆಯಾ ಅಥವಾ
ಅಂದ್ರೆ
ಆಗೋದೇ ಅಂದ್ರೆ 1 ಪಾಯಿಂಟ್
ಹಾ,
ಮಾಡಿದಾಗ
ಹಾ.
ಇಟ್ ವಿಲ್ ಆಲ್ರೆಡಿ ಬಿ
ಹೀಟೆಡ್ ಶರ್ಟ್. ಹಾ,
ಸೊ
ಅದಕ್ಕೆ ನೆಕ್ಸ್ಟ್ ಪಾಯಿಂಟ್ ಅಲ್ಲಿ ಇರುವಾಗ ನಾನು ನೋಡ್ತಾ ಇದ್ದೀನಿ. ಹಾ, ಹೌ ಗ್ರಾಜುವಲಿ ಹೀಟ್ ಆಗಬೇಕು, ಬಟ್ ಲೂಕ್ ವಾರ್ಮ್ ಇದ್ರೆ ಕೂಡ ಆಗುತ್ತೆ. ಯು ಶುಡ್ ನಾಟ್ ಫೀಲ್ ಇಟ್ ಈಸ್ ಮೋರ್ ಬರ್ನಿಂಗ್ ಅಂತ ಅಷ್ಟೇ. ಈಗ ನೋಡಿ, ಹಾಂ, ಟಿಲ್ ದಟ್ ಟೈಮ್ ಯು ಟೇಕ್ 1 ರೌಂಡ್ ಅಂತ. ಬನ್ನಿ ಸರ್.
ಬನ್ನಿ ಹಂಗೆ.
ಏನಾಗ್ತದೆ?
ಮೈಕಿ ಮೇಲೆ
ಹಾಂ,
ಇದ್ದಕ್ಕಿದ್ದಂಗೆ ಒಂದ್ಸರಿ ಇದು ವರ್ಕೇ ಇಲ್ಲ, ಆಗಲ್ಲ 1 ಸೆಕೆಂಡ್. ಆಮೇಲೆ ಏನಾರ ಹಿಡ್ಕೊಂಡ್ಬಿಟ್ರೆ
ಹಾ.
1 ಸೆಕೆಂಡ್ 2 ಸೆಕೆಂಡ್
ಹಾ.
ಸರಿ ಹೋಗುತ್ತೆ.
ಹಾ.
ಇಲ್ಲ ಅಂದ್ರೆ ರಪ್ ಅಂತ ಬೀಳೋದು.
ಹೌದಾ?
ಇಲ್ಲಿ ಮೋಸ್ಟ್ಲಿ ಏನೋ ಜಾಯಿಂಟ್ ಪೇಂಟ್ ಏನಾರ
ಎಲ್ಲಿ ನೋವು?
ಇದೆಯೋ,
ಎಲ್ಲಿ ನೋವು ಜಾಸ್ತಿ?
ಇಲ್ಲಿ ಇದಿಷ್ಟು ಭಾಗ.
ಇಷ್ಟು ಭಾಳ.
ಮೊದಲು ವಾರಕ್ಕೆ 2 ಸಾರಿ ಬೀಳ್ತಾ ಇದ್ದೆ.
ಹ್ಮ್.
ಆಮೇಲೆ ಹೆಗ್ಗಡೆ ಹತ್ರ ಹೋದೆ,
ಹ್ಮ್.
ಅವರು ಆಪರೇಷನ್ ಮಾಡಲೇಬೇಕು.
ಹ್ಮ್.
ಬೇಡಪ್ಪ, ಇಲ್ಲ ಆಪರೇಷನ್ ಆದ್ರೆ ಬೇಡ.
ಹ್ಮ್.
ಆಮೇಲೆ ಕೆಲವು ಎಕ್ಸಸೈಜು ಹೇಳ್ಕೊಟ್ರು.
ಹ್ಮ್.
ಅದು ಹೇಳ್ಕೊಟ್ಟಾದ್ಮೇಲೆ ವಾರಕ್ಕೊಂದ್ಸರಿ ಬೀಳ್ತಾ ಇದ್ದೆ.
ಹ್ಮ್.
ಈಗಲೂ ಯಾವಾಗಲೂ ಒಂದ್ಸರಿ ಇದು ಒಂಥರ ಈ ಜೋಬ್ ಬಂದಂಗೆ ಆಗುತ್ತಲ್ಲ,
ಹ್ಮ್.
ಇದಕ್ಕಿದಂಗೆ ಸ್ಟ್ರೆಂತ್
ಇಲ್ಲ ಅಂತ. ಹಾಂ,
ಹೊಟ್ಟೋಗುತ್ತೆ. ಬಟ್ ಆಮೇಲೆ ಆಟೋಮೆಟಿಕ್ ಆಗಿ 1 ಸೆಕೆಂಡ್ 2 ಸೆಕೆಂಡ್ ಅದೇ ಸರಿ ಹೋಗ್ಬಿಡುತ್ತೆ.
ಓಕೆ.
ಬಟ್ ನಾವೇನು ಹಿಡ್ಕೊಳ್ಳಿಲ್ಲ ಅಂದ್ರೆ ಬೀಳ್ತಾರೆ.
So this is chronic case. In such case, we need more sittings. So we can do 1 sitting now, but we need more sittings to calm this down. ಈಗ ನೋವಿದೆನಾ?
ಇದೆ.
ಎಲ್ಲಿ ನೋವು? ಫುಲ್ ಇಡೀ?
ಇಲ್ಲಿ ಇಷ್ಟು ಮಾತ್ರ.
ಹಾಂ.
ಬಟ್
ಈ ಕೈ
ಏನೂ ಇಲ್ಲ, ಇಲ್ಲ.
ಏನಾದ್ರು ಬಿದ್ದಿದ್ರಾ ಮುಂಚೆ?
ಬಿದ್ದೆ ಏನಂದ್ರೆ ಹಿಂದೆ ಏನೋ ಸ್ಕೂಟ್ರಲ್ಲಿ ಬಿದ್ದು ಆ ಹ್ಯಾಂಡ್ಲು ಇಲ್ಲಿ ಇಟ್ಕೊಂಡ್ಬಿಟ್ಟಿದಿರ್ಬೇಕು.
ಹಾ.
ಅದೇನಾಗೋಯ್ತು, ಏನಾದ್ರು ಮೂಳೆ ಆ ಕಡೆ ಈ ಕಡೆ ಜಸ್ಟ್ ಒಂದು ದಾರದಷ್ಟು ಬ್ರೇಕ್ ಆಗಿರಬಹುದು.
ಹಾ.
ಅವರು ಹೆಗ್ಡೆಯರು ಇಲ್ಲಿ ಆಪರೇಷನ್ ಮಾಡ್ತೀನಿ,
ಹ್ಮ್.
ನೀವು ಒಂದು 2 months ಅಡ್ಮಿಟ್ ಆಗಬೇಕು. ನನಗೆ ಮೊದಲೇ ಆಪರೇಷನ್ ಅಂದರೆ ಭಯ. ಬೇಡಪ್ಪ, ಇದು ಆಪರೇಷನ್ ಗಿಪ್ರೇಷನ್ ಬೇಡ. ಆ ಮಂಡಿಯಲ್ಲಿ ಒಬ್ಬ ಇವನಿದ್ದಾನೆ ಪೈಲ್ವಾನ್, ಅವನು ಒಂದು ಡೇಟ್ ನೋಡಿದ್ರೆ ನಾನು ಸತ್ಯ ಹೋಗ್ತೀನಿ. ಅವನೇನು ಮಾಡ್ತಾನೆ ಅಂದ್ರೆ ಈ ಮೂಳೆ ಬ್ರೋಕನ್ನು ಗೀಕನ್ನು ಅದೆಲ್ಲ ಸರಿ ಮಾಡ್ತಾನೆ. ಅಲ್ಲಿಗೆ ಎಲ್ಲೆಲ್ಲಿಂದ ಬರ್ತಾರೆ ಅಂದ್ರೆ ಊಟಿ ಪಾಟಿ ಎಲ್ಲ ಕಡೆಯಿಂದಲೂ ಬರ್ತಾರೆ. ಆಮೇಲೆ ಇಲ್ಲಿ ಬೇರೆಯ ಒಂದು ರೂಟ್ ಇದೆ, ಅಲ್ಲೊಬ್ರು ಅವನು ಏನು ಓದುವಿಲ್ಲ ಏನೂ ಇಲ್ಲ, ಮೂಳೆ ಡಾಕ್ಟ್ರು ಅಂತಾನೆ, ಮೆಹಬೂಬ್ ಖಾನ್ ಅಂತ ನಗರ ಅವನು. ಅವನು ಓದೇ ಇಲ್ಲ ಅವನು. ಅವ್ರಪ್ಪನೂ ಮೂಳೆ ಎಲ್ಲಿ ಸರ್ ಮಾಡ್ತಿದ್ದಂತೆ. ಅಲ್ಲಿ ಎಲ್ಲವ ರೋಡ್ ಕರ್ನಾಟಕ ಎಲ್ಲಾರು ಬರ್ತಾರೆ. ಅದೇನೋ ಮಲ್ಗಿಸ್ಬಿಟ್ಟು ಅದೇನೋ ಫಟ್ ಅನ್ಸ್ಬಿಡ್ತಾನೆ, ಮೂಳೆ ಕೂತ್ಕೊಂಡ್ಬಿಡ್ತು ಅಂತಾನೆ. 500,000 ಕಿತ್ಕೊಂಡು 5 ಗಂಟೆಗೆ ಟೋಕನ್ ಬೇರೆ. ಅಯ್ಯೋ ಮೊದಲ ಏನಿದು ಕತೆ, ಓದಿಲ್ಲ ಮಾಡಿಲ್ಲ ಏನಿಲ್ಲ. ಅವನ ಹತ್ರ ಟೋಕನ್ 200 ಆದ್ಮೇಲೆ ನೋಡ್ಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ ಅಂತ MLA ಹೇಳಿದ್ರು, ರೆಕಮೆಂಡೇಶನ್ ಮಾಡಿದ್ರು, ನೋಡೋದಿಲ್ಲ. ಅದ್ ಏನ್ ಕತೆಯೋ ಏನ್ ಬಾರ್ದು. ಇನ್ ನಮ್ಮಲ್ಲಿ ಎಲ್ಲ ಕೆಲವರೆಲ್ಲ MBBS MS ಆರ್ಥೋ ಅಂತಾರೆ. ಆ ನನ್ನ ಮಕ್ಕಳು ಏನು ಮಾಡೋದು.
ಅದು ಮಾಡಿದ್ಮೇಲೆ ಕೂಡ ಕಡಿಮೆ ಆಗಿಲ್ಲ.
ಅದೇನ್ ಕಡಿಮೆ ಆಯ್ತು ಏನೋ. ನಾನು ಹೋದೆ, ಆಗ್ಲಿಲ್ಲ. 1,000 ಕೊಟ್ಟೆ,
ಸ್ವಲ್ಪ
ಹೆಂಗಾಗ್ಬಿಟ್ಟಿದೆ ಅಂದ್ರೆ ದುಡ್ಡು ಕೀಳಕ್ಕೆ ಫ್ಯಾಷನ್ ಆಗ್ಬಿಟ್ಟಿದೆ. ಈಗ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಈಗ ಲೇಡೀಸ್ದು ಡೆಲಿವರಿ ಕಾಮನ್. ಬೆಳಗಿನ ರಂಗನ ಬೆಟ್ಟದಲ್ಲಿ ಮಾಸ್ತಮ್ಮ ಅಂತ ಇಲ್ಲೊಬ್ರವ್ರೆ, ಅವರು ಕಾಡಲ್ಲೇ ವಾಸ. ಅವರು ಹೆಚ್ಚು ಕಡಿಮೆ 3,500 ಜನ ಲೇಡೀಸ್ಗೆ ಹೆರಿಗೆ ಮಾಡಿದ್ದಾರೆ. ಈ ನನ್ನ ಮಕ್ಕಳು MBBS DGO MS ಬರೀ ಕುಯ್ಯೋದು 2,000. ನಮ್ ದೇಶ ಯಾವ ಮಟ್ಟಕ್ಕೆ ನೋವು ಅಜ್ಜೆ ಹಾಕಿದ್ರೆ ನೋಸ್ ಎಲ್ಲ ಇರ್ತದೆ, ನಡೆಯುವಾಗ ಉಂಟು. ಮಲ್ಕೊಂಡ್ರೆ ಏನಂದ್ರೆ
ಅದೇ ಈಗ ಏನ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ಕೆಲವೊಂದು ಜಾಗದಲ್ಲಿ ಸೂಜಿ ಚುಚ್ತೀವಿ, ಆಮೇಲೆ ನೀವು ಹೇಳ್ಬೇಕು ಆಕ್ಯುಪಂಕ್ಚರ್ ತರಾನೇ, ಆಕ್ಯುಪಂಕ್ಚರ್ ಇಲ್ಲ.
ಅಲ್ಲೆಲ್ಲ ಒಬ್ರು ಇಲ್ಲಿ ಆಕ್ಯುಪಂಕ್ಚರ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ಇಲ್ಲೆಲ್ಲ ಚುಚ್ಚಿದ್ರು
ಒಂದು ಸ್ವಲ್ಪ ಬೆಂಡ್ ಮಾಡಿ ಕೆಳಗಡೆ ಇಡಿ.
ಆಕ್ಯುಪಂಕ್ಚರ್ ಅಂದ್ರೆ ಸೂಜಿ ಚುಚ್ಚೋದು ಒಂದು 5 ನಿಮಿಷ 10 ನಿಮಿಷ. ಬಟ್ ಅದೇನು ಒಳಕ್ ಹೋಗಲ್ಲ, ರಕ್ತ ಬರಲ್ಲ.
ಇಲ್ಲಿ ಒಂದ್ ಸ್ವಲ್ಪ ಬರ್ಬೋದು
ಎಲ್ಲಿ
ರಕ್ತ
ಬರುತ್ತಾ?
ಸ್ವಲ್ಪ
ಅಂದ್ರೆ ಏನು ಒಂದ್ ಲೋಟನ
ಇಲ್ಲ,
ಒಂದ್ಸರಿ ಹೋದ್ರೆ ಸರಿ.
ಲೂಸ್ ಬಿಡಿ,
ಆರಾಮಾಗಿರಿ, ಫ್ರೀ ಆಗಿ. ನೋವಾಯ್ತಾ ಇದೆಯಾ?
ಒಂಚೂರು ಇಲ್ಲ ಆಗುತ್ತೆ,
ಇರ್ಬೇಕಷ್ಟ ಆಯ್ತಾ?
ಆಕ್ಯುಪಂಕ್ಚರ್ಗೂ ಇಲ್ಲಿ
ಮತ್ತೆ is telling that while walking also it is difficult, so ಗೃಧ್ರವತ್ ಚಲತೈತಿ.
ಕುಂಟುತ್ರ ನಡೀತೀರಾ? ಕುಂಟದಾಗ ನಡೀತೀರಾ?
ನಡೀತೀನಿ, ಇಲ್ಲೇನಿಲ್ಲ. ಇದೆಲ್ಲ ಸೂಜಿನೇ ಚುಟ್ಟಿಲ್ಲ, ಅದೇವ್ರು ಸೂಜಿ ಹಾಕ್ಬಿಟ್ಟು ಅದು ಸೂಜಿ ಹಂಗೆ
ಈ ಕಾಲಿಗೆ ಕೂಡನಾ? ಈ ಕಾಲಿಗೆ ಕೂಡ ಇದೆನಾ?
ಇಲ್ಲ
ಇಲ್ಲ,
ಆ ಕಾಲಲ್ಲೇನು ಇಲ್ಲ ನೋಡಿ.
ಈಗ ನಡ್ಕೊಂಡ್ ಬನ್ನಿ ಹೇಗೆ ಆಗಿದೆ ಅಂತ ನೋಡಿ.
ಈಗ ನಡೀರಿ. ಈಗ
ಕಡಿಮೆ ಇದೆನಾ ಅಥವಾ ಹಾಗೆ ಇದೆನಾ, ಸ್ವಲ್ಪ ಲೂಸ್ ಅನ್ಸ್ತಾ ಇದೆನಾ, ಹೇಗೆ ಅಂತ ನೀವು ಹೇಳ್ಬೇಕು ಹೇಗಿದೆ.
ಕಾಣಿಸುತ್ತೆ.
ಹೌದು.
ಯಾವ ಇದಕ್ಕೆ
ಅದೇ ಆಮ ಸಾಮ
ಬಿಟ್ಟರು ಏನೋ ಆಮ ಲಕ್ಷಣಗಳು ಇಲ್ಲದೆ ಇದ್ರು
ಹಾ.
ಕೆಲವೊಮ್ಮೆ ಆ ರೀತಿ ಆಗೋದು ಏನಕ್ಕೆ?
ಇಲ್ಲ, ಸಾಮ ಇರುತ್ತೆ, ಅದು ಸ್ವಲ್ಪ ಆದ್ರೂ ಇರುತ್ತೆ. ಆಮ
ಸಾಮ ಕಂಡೀಷನ್ ಅಲ್ಲಿ ವಿಡ್ರಾ ಮಾಡಿ ಅಗ್ರವೇಟ್ ಆದ್ರೆ
ಹ್ಮ್
ಅವಾಗ ಹೇಗೆ ಮ್ಯಾನೇಜ್ ಮಾಡ್ತೀವಿ?
ಅಗ್ನಿಕರ್ಮ. ಈಗ ನಾನು ಲಾಸ್ಟ್ ವೀಕೆ ಒಂದು ಪೇಷಂಟ್ ಬಂದಿದ್ದು, ನಾನು ವಿದ್ದ ಮಾಡಿದೆ, ಸ್ವೆಲ್ಲಿಂಗ್ ಇತ್ತು ಅದಕ್ಕೆ, ಬಟ್ ಅದು ಆಮವಾತಕ್ಕೆ ಹೋಗಿ ನಾನು ಚೆನ್ನಾಗಿ ನೋಡಲಿಲ್ಲ ನಾನು. ಸೊ ಅವಾಗ ನಾನು ಅಗ್ನಿಕರ್ಮ ಮಾಡಿದೆ, ಸೊ ಅವಾಗ ಕಡಿಮೆ ಆಗಿದೆ ಈಗ.
ಅದೇ ಪಾಯಿಂಟ್.
ಅದೇ
ಸರ್, ಅಗ್ನಿಕರ್ಮ ಸ್ವರ್ಣಶಾಲಕರಲ್ಲೇ ಮಾಡ್ಬೇಕಾ ಇಲ್ಲ?
ಎಲ್ಲದಕ್ಕಲ್ಲ,
ಈಗ ಇವ್ರದ್ದು ಅಗ್ನಿ ಮಾಡಿದ್ರೆ ಅಗ್ನಿ ಮಾಡ್ಬೋದಾ ಈ ಕಂಡೀಷನ್ ಅಲ್ಲಿ?
ಮಾಡ್ಬೋದು.
ಅಲ್ಲ ಅವಾಗ ಡಿಫ್ರೆನ್ಸ್ ನಮ್ಗೆ ಏನಾದ್ರು ಗೊತ್ತಾಗುತ್ತೆ ನೀಟಾಗಿ?
ಅದ ಹಾಂ, ಮಾಡ್ಬೋಣ, ಮಾಡೋದು.
ಮೇಲೆ
ಮಾಡ್ಬೋದು. ಈಗ ಸೇಮ್ ಪಾಯಿಂಟ್ಸ್ ಅಲ್ಲಿ ಮಾಡಬಾರ್ದು, ಸ್ವಲ್ಪ ಸೈಡಲ್ಲಿ ಎಲ್ಲಿ ವಿದ್ದ ಮಾಡ್ತೀವಲ್ಲ ಸ್ವಲ್ಪ ಸೈಡಲ್ಲಿ
ಸರ್ ಸೇಮ್ ಪಾಯಿಂಟ್ ಇರಬಾರ್ದು.
ಸೇಮ್ ಪಾಯಿಂಟ್ ಇರಬಾರ್ದು, ಸ್ವಲ್ಪ 1-2 ಮಿಲಿಮೀಟರ್ಸ್ ಆಚೆ. ಎಸ್, ಇದು ಎಷ್ಟು ಬಿಸಿ ತಡ್ಕೊಳಿಕ್ ಆಗ್ತದೆ ಅಷ್ಟು ತಡ್ಕೊಳ್ಳಿ ಆಯ್ತಾ. ನಿಧಾನವಾಗಿ ಬಿಸಿ
ತುಂಬ ಜಾಸ್ತಿ ಆದರೆ
ಹೇಳ್ಬೇಕು, ನಿಧಾನವಾಗಿ ಬಿಸಿ ಆಗ್ತಾ ಹೋಗುತ್ತೆ, ಹೇಳ್ಬೇಕು.
ಸ್ವಲ್ಪ ಆಗ್ತಾ ಇದೆ.
ಎಷ್ಟು ತಡ್ಕೊಳಿಕ್ ಅಷ್ಟು ತಡ್ಕೊಳ್ಳಿ.
ಸಾಕು ಸಾಕು
ಸಾಕು.
ಪಿತ್ತದ ಕಂಡೀಷನ್ಗಳೆಲ್ಲ ಕೊಡ್ಬೋದು, ಯಾಕಂದ್ರೆ ಅಗ್ನಿ ಮತ್ತು
ಪಿತ್ತಜದಲ್ಲಿ ಕಾಂಟ್ರಾ ಇಂಡಿಕೇಟೆಡ್ ಇದೆ.
ಸಾಕು.
ಆಲ್ವೇಸ್ ಚೆಕ್ ಮಾಡಬೇಕು ನೆಕ್ಸ್ಟ್ ಪಾಯಿಂಟ್ಗೆ ಇಡುವಾಗ ಎಷ್ಟು ಟೆಂಪ್ರೇಚರ್ ಇದೆ,
ಎಷ್ಟು ಬರುತ್ತೆ. ಸರ್ ಸಾಕು.
ಈಗ ನಡ್ಕೊಂಡು
ನಡೆದು ನೋಡಿ
ಬಿಡ್ಲಾ ಪ್ಯಾಂಟು?
ಅದೇ ಕ್ರಾನಿಕ್ ಇದೆ, ಅದಕ್ಕೆ ಬೇಗ ಕಮ್ಮಿ ಆಗೋದಿಲ್ಲ. ಬೇಕಾಗ್ತದೆ. ಒನ್ ವೀಕ್ 2 ವೀಕ್ ಮಾಡಬೇಕು ಡೈಲಿ. ಅದು ಎಲ್ಲ 6 ಪಾಯಿಂಟ್ಸ್ ತಗೋಬೇಕು. ವಿದ್ದ ಫಸ್ಟ್ ಕ್ಷಿಪ್ರ ತಗೊಂಡಾದ್ಮೇಲೆ I'll show that one case later. ಅದು ಸ್ವಲ್ಪ 2 ನಿಮಿಷ ಇರುತ್ತೆ, ಅದು ಆಮೇಲೆ ಹೋಗುತ್ತೆ. ಬಟ್ ಏನಾದ್ರು ಲೂಸ್ ಅನ್ಸ್ತಾ ಇದೆ ಆ ಜಾಗದಲ್ಲಿ, ಒಂಥರ ಟೈಟ್ ಇತ್ತು ಮೊದಲು, ಈಗ ಲೂಸ್ ಆಗಿದೆ ಅಂತ. 0.1 ಹಾಗೆ. ಅದೇ ತುಂಬಾ ವರ್ಷದಿಂದ ಇದೆಲ್ಲ, ಅದಕ್ಕೆ ಸ್ವಲ್ಪ ಲೇಟ್ ಆಗಿ ನಿಮ್ಗೆ ಕಡಿಮೆ ಆಗ್ಬೋದು. ಅದು ಒಂದೇ ಸಿಟ್ಟಿಂಗ್ ಅಲ್ಲಿ
ಬೀಳದೆ ಹೋದಂಗೆ ಆದ್ರೆ ಸಾಕು.
ಹಾ
ಇದ್ದಕ್ಕಿದ್ದಂಗೆ ಏನಿಲ್ಲ.
ಅದೇ ಎಸ್.
ಒಂದು ಚೇರು, ಮೂಳೆ, ವಾಟರ್ 1 ಸೆಕೆಂಡ್ 2 ಸೆಕೆಂಡ್
ಹ್ಮ್
ಆಮೇಲೆ ಅಪ್ ಟು ಡೇಟ್ ಆಗೋದು.
ಹೌದು.
ಅವಾಗ ಹಿಡ್ಕೊಳ್ಳಿಲ್ಲ ಅಂದ್ರೆ ಬೀಳೋದು.
ಬೀಳೋದು. ಹೌದು. ತಲೆ ಸುತ್ತು ಬರುತ್ತೆ. ತಲೆ ಸುತ್ತು ಬರುತ್ತೆ. ತಲೆ ಸುತ್ತು.
ತಾನೇ?
ತಲೆ ಸುತ್ತು